Hi, my name is E-Shawn. I'm a senior oculoplastic surgeon with Eagle Aesthetic Surgery. I'm here to ask a couple of questions to one of my colleagues, Dr. Petrina Tan. She's also a senior consultant oculoplastic surgeon. Dr. Tan,
Hi.
you're new to the practice.
Yeah.
I thought I'd ask you a couple of questions that some of my patients always ask me as well. So one of the most common questions I get is that, how are you going to do the surgery? Like, is it going to be painful? Like, will they be aware of what's going on? So what's your preference for patients?
Actually, I get that a lot, that patients actually say that they're really scared and they want to be asleep and they won't feel any pain during the procedure. My preferred is actually what I call an awake blepharoplasty. So usually I would give the patients a little oral sedative to calm their nerves. After that, I give a local anesthetic injection. I do have some techniques that I use to distract the patients during the local anesthetic injections. For example, talking to the patient, giving them a little squeeze ball, tapping on their forehead. And actually, by the time I'm done with that, I'm done with my injections and patients are totally numb and they do not feel the procedure. There are a lot of advantages with awake blepharoplasty as well. I'm sure you would know that too.
Absolutely. I think like 99% of my patients are always awake. I like to keep them nice and calm. Preferably not talking too much, because sometimes, oh gosh, I spend so much effort trying to entertain the patients, but really just trying to get the surgery done as well. One of the other questions I always get from patients is that, like, how are you going to do the surgery? Because I know from your techniques as well, because you trained with quite a lot of famous surgeons as well. So you know how to do ptosis surgeries in many different ways, right? There's the anterior approach, there's the posterior approach. How do you clarify this for patients? How do you offer them to patients? And how do you help them decide which way to do it?
Yeah, so there are many techniques, just like there are many smartphone brands, but really each patient has their own special things that we consider when we look at the face. And so actually, I usually always tailor my technique to the patient. So really, there are many techniques around, but I look at the patients, evaluate them, and then I tailor it to the patient. So if the patient has a lot of extra skin, we have to make the incision from the front. But if there's no extra skin, actually my preferred is the posterior approach, a scarless surgery, whereby I make incision from behind. I do not remove any excess tissue, and actually just with 2 stitches, I tighten the muscle, and this gives me a very predictable result.
Absolutely.
And most important, minimal post-operative swelling.
And it's so natural, isn't it? The crease is so natural.
Yeah.
The double eyelid looks so good.
Yeah, that's right.
The patient is back to work so quickly, right? They pay your bill and they're back at work. Yeah, absolutely. I agree. Sometimes I even combine a posterior approach with a bit of a skin tuck as well, so just to clean up the double eyelid so that the patients have a nice double eyelid. Do you ever do that?
Yeah, sometimes, as I said again, it's really very important to look at the patients and decide what they really need. So yeah, the patient's most important.
Absolutely. Thanks so much for your time, Dr. Tan.
Thank you.
We'll look forward to seeing you in the clinic. Bye-bye.
Bye.